Welcome back to Rohrich Knows Podcast. The deep plane facelift, it's all over social media. What is it? Should you do it? Should you not? And what does it really do? Is it really better than the routine facelift, or what is a routine facelift? So we have with us today a world expert on deep plane facelift, Dr. Babak Azizzadeh, who's the chief of facial plastic surgery at Cedars-Sinai, and he's a world expert in facial rejuvenation and in facial animation. So Babak, welcome. How are you?
Thank you so much, Rod, for having me. It's such a pleasure, and as always, an honor to be an invited guest on this, on this amazing podcast.
So Babak, let's get into it. So, okay, you and I, we do a lot of facelifts, and we have patients from around the world. So, what is the deep plane facelift? I mean, it's really been the hottest thing on social media for facial rejuvenation. And, all our patients say, do you do the deep plane? Do you do the deep layer? So can you sort this out for the audience and tell us what's the myth and what's the reality?
Yeah, so the deep plane facelift, as we know, has been around for a while. Sam Hamra was kind of the pioneer, and essentially what the concept was that instead of kind of repositioning the top layer of the skin and lifting the top layer of the skin, let's get into the slightly deeper structural layers of the skin and muscles, so that we're not just pulling the sheet over the bed and cleaning, or making our bed in the morning. Let's get the blankets and everything like really straightened out. And that's really kind of what the deep plane is. I think it's a structurally and physiologically very sound repositioning of tissues that gives, what most of us believe, a more natural, youthful, and long-lasting procedure. Because a lot of times if we're just lifting the skin, or we're not, getting a really great structural lift, we may not get that longevity and naturalness. So that's kind of, why I think it's really gained a lot of popularity. Again, since COVID, I would say just really blew up over the last 5-6 years, even though many surgeons have been doing it for a long, long time.
Right, and I think that's a very good explanation of it. I think the biggest thing is, anytime, you're going into the deep tissue. I mean, today, I know there's still people that just do a skin-only facelift, which probably should not be done at all. But there are different types of deeper layer facelifts. There are the smash facelifts, and then there's the composite, and then the deep plane, and I just want to clarify that, obviously most of the action occurs in the mobile part of the smash. I mean, that's where it all happens, whether you're doing a smash, a sub-smash, or a deep plane. So are you really going deep, or are you just extending more medially? For the audience, because there's a lot of delicate structures, specifically the facial nerves, and of which Babak is an expert in facial nerves. So I'm going to really drill him on this, because I do see some of these patients, and then you have to know your anatomy. That's why you should either be a board-certified plastic surgeon or a board-certified facial plastic surgeon should be doing this. I don't think anybody else should be doing this, because this is a real anatomy course on this. So tell us about that, because I think of course I know exactly the anatomy there, but you're going more medial. You're extending it medial. You're releasing the ligaments more medial, and you're lifting the deep tissue. So tell us about that.
Well, no one's done more, obviously, in terms of explaining the anatomy than you have in all your amazing published papers from many years back with the fat compartments and understanding kind of the different layers, right? And so the real fact, a couple of things before we even get into that. No two surgeons do the same deep plane.
That's right.
So that's the first thing I'm going to say. There are surgeons that say I do a deep plane facelift, and they're showing videos. I'm like, no, that's a SMAS facelift, right?
Right.
Or someone's saying, oh yeah, I'm doing a mini facelift, and they're doing a deep plane facelift. So the terminology, it kind of actually annoys me, because it always because everyone's doing something different. But technically speaking, you have multiple layers to the face. You have the skin, then below the skin, you have kind of a structural support layer that's the SMAS. It's kind of like our structural support to the face.
Right.
And the neck area, that essentially transitions into the platysma. So the key thing, what a true deep plane facelift is, that you go raise a little bit of skin, then go right deep under the SMAS, and elevate. And some people go all the way to the laugh line, some people go halfway through. I don't think actually that's as important. And in the neck, some people go above the platysma, some people go an extended deep plane below the platysma.
Right.
That's my preference. I kind of like the SMAS and platysma, lift them all together and go anterior. But really the key thing, I think, in the cheek area is releasing those ligaments.
Right.
Because as soon as you release those ligaments, it doesn't matter how far further you go. It does make a little bit of difference, but not a ton. And the same thing in the neck area and the mandibular area. And the challenge is this, deeper to this are the branches of the facial nerve. So it is one of those techniques that I'd rather, if I'm having this facelift done, if someone says, oh, I do a SMAS facelift, I'd rather them do a SMAS facelift that they do all the time, rather than force them to do a deep plane facelift where it does require, I think, a much more in-depth expertise and experience, because the nerves are there. And I just did a really, we're going to hopefully publish it soon, a large survey of physicians that are doing, and it is taking off. I mean, I would say 85, 90% of surgeons say now they're doing deep plane facelift.
Right.
Facial nerve injury, self-reported by doctors, which is never, it's like basically between almost 8%.
I know, that's not good.
But even though it's temporary for the most part, so no alarm, facelifts are safe, and deep plane are really safe. But look, managing someone who has a little lower lip crookedness for 3 months, and you have, let's say you're doing 50 facelifts a year, that's a lot of patients that are constantly walking into your office with crooked lips.
Right.
So it does require, I think, a lot of expertise. Sorry for the long-winded answer, but that's kind of...
No, I agree. I agree. And I think people need to do what they're comfortable with. And if they're going to learn a new technique, it's just whether it's rhinoplasty or facelift, you got to you got to go see somebody, you got to watch them do it. I mean, the videos are fine, but I really think it's an area that you really, unless you're not comfortable, if you're comfortable with it, and you've done a lot of facelifts, I totally agree, because, do no harm is a big deal. And, I just did a systematic review of comparing the sub-SMAS to do the true deep plane facelifts, and it was like 8 or 9 articles that had outcomes with it. So there weren't that many. And it did show that the facial nerve injury was a little higher, not statistically so, and that the outcomes were similar. But in the deep plane, the mid-face was better. The mid-face was better, but in the sub-SMAS, the jawline was as good. But in the mid-face, the jawline, the deep plane was better. And it is, it's the ligaments. It's like a metacutaneous, a mandibular, and then the parotid cutaneous, and the mesenteric ligaments. And those are all there. You got to release them, but in that proximity of the facial nerve. So that's the key. And so I totally agree with you. Both at our meeting and at your meeting, I saw so many deep plane techniques. At our meeting, it's the same way, Babak. I said, is that really a deep plane? People say, well, that's how I've evolved it. So the deep plane is a deep plane is a deep plane. And I revise a lot of patients, and I go, wow, I don't think the deep plane was touched here. So fortunately, so I think it's kind of know before you go. So what advice do you have for the consumer? When they're looking on Instagram or TikTok and they're saying there's a deep plane. What do you say to the patient? And obviously, I mean, you and I see all this all the time.
Yeah. So in fact, I just published my first Substack that is talking exactly about this.
But you did?
Oh. Plain facelift. Literally, I just went on. I probably have like 4 views on it, but I just published this really deep dive into it. And okay, so first of all, you have to make sure the doctor, before you even go see a doctor, I don't know if you agree with me on this or not, I think you have to do all your homework.
Yeah.
Right? And not just homework on TikTok, not on social media, really looking at the peer vetting system. And we've talked in a separate podcast about persona or
Right.
your plastic surgeons or dermatologists that see this all the time and find out who's good. Then you got to look at their before and afters.
Right.
Before and afters don't look good to you. They don't look natural to you. They're not fitting your aesthetic. It doesn't matter what approach they're using, right? It doesn't matter the deep planes or a smaz. But I do think once you go in, it is important to say, hey, what technique do you use? Not too much. And if they're in that technique, the only question I would say is like, look, what's your complication rates and what do you do and how do you manage it? I think that's really a very simple way. I'm not too into, I do think, and I exclusively do an extended deep plane facelift, and I love it, and I think it is the best, to me, I love the results, and I've done it always. I mean, in 20 years, my first 10 years was like a smaz imbrication. I love the results are good. I still have my before and afters on and so forth. But I do think the deep plane gives you that mid-face aesthetics. But there are two other things that I talk about that are just as important as the technique. And again, I'd love to get your input in this. It's the ancillary procedures and the aesthetic eye of the doctor. There are some doctors that do deep plane facelifts. They just have a really poor cosmetic eye. They don't get great looking results.
Right.
And ancillary procedures, like what they do with their eyes, fat grafting, all of those laser restrict, those are also very critical. And the second thing is the neck. You could do a deep plane facelift, but if you're not managing the neck,
I agree.
and sometimes you have to do the deep fat compartments, sometimes you got to do glands, sometimes you got to do digastric, platysma, you won't get a great result. You could do a beautiful deep plane facelift, but you won't get a great result if you're not really focused in on what you do in the neck, fat grafting, and the ancillary procedures.
I agree, 100%. And I mean, I always tell my fellows and residents that a good face, you got to give them a good neck, and you got to restore the central facial fat, because you can't, no deep plane or anything can get that. You have to centrally. So I augment the central face. You give them a good jawline, whatever way like you mentioned, in the deep layer facelift, deep plane facelift. You got to have all three, but you can't do one thing. And you have to stylize it and customize it for each patient. Every patient's different. And I think that's the beauty of the artistry of the surgeon. And so choose your surgeon wisely. And I think that's what you're saying. And I'm going to look at your Instagram when we get done here. So so it's good. No, it's good. Wow, great minds think alike. I mean, I love that. So closing comments, know before you go, choose wisely, choose somebody who's got expertise in it and can explain what the deep plane, deep layer facelift is, and have them show great results. And then be safe. Don't do crazy stuff. Don't do crazy stuff. I see, we all see lots of crazy stuff, and don't do crazy.
It's a elective procedure at the end of the day, and that's kind of what I tell everyone. I mean, I spend probably a lot of time talking about safety. Probably not many people talk about that in their consultations. I spend a lot of time on that. And, sometimes, I think that's very trivial for some people, but you're doing an elective procedure, right? There, if you need to go back and do a little touch up, it's fine. But if someone has nerve damage or like has a major complication or, has this is elective. Of course, complications can happen even in the hands of the best surgeons, but you want to really minimize that.
Yep, no, I agree. Wise words from a wise surgeon. Dr. Babak Azizzadeh, and his co-founder of Persona, and check that out on a podcast we've done recently. So know before you go. Stay well informed and stay safe.